Hi, my name is Nikki. I'm a student of the occupational therapy program at the Brazos Institute, and today we're gonna be doing measurement of the upper extremities as well as manual muscle testing of the upper extremities. Okay. So now we're gonna measure the shoulder flexion, which is from the degrees 0 to 180. I'm using a 12 inches goniometer. The patient needs to be sitting in a chair, feet on the floor, good posture, and start with arms hanging down the side. The fulcrum will be 1 inch below the acromion process, and the stationary arm will be pointed to the floor, and the mobile arm will go along with the midpoint of the humerus. My instruction to the patient will be to keep the arm straight as possible and raise forward and overhead as high as possible. Tongue should be always pointed upward. So can you please go ahead and raise your arm as much as you can. So now for the manual muscle testing for shoulder flexion. The patient needs the arm to be in this position at 90 degrees, and my instruction to the patient will be to hold and then push it down. Hold your arm. Thank you. Okay, so now we're gonna do the shoulder extension, the motion, the shoulder extension motion, which is from 0 to 60 degrees. I'm using the 12 inches goniometer, and the tested position in this case, the patient needs to be sitting in a chair, good posture, feet on the floor, and the arms to be on the sides, pointing to the floor. Now my instructions for the patient will be to keep the arm straight and extended as far as possible, and of course to make sure the patient is not moving the shoulder or rotating the shoulder. The mobile arm will go along the lateral midpoint of the humerus, and the stationary arm will be pointing toward the floor. So can you please go ahead and extend your arm as much as you can. Now we're gonna measure shoulder extension, manual muscle testing. So it needs to be on prone, and I will be stabilizing right here between the scapula. And my instruction will be, please raise your arm back forward, as much as you can. Don't let me push it down. Thank you. Okay. Now we're gonna do shoulder abduction. This will be the measure at the degrees of 0 to 180. I'm using the 12 inches goniometer. I'll need the patient to be sitting in a chair, feet on the floor, good posture, and we need to measure from the back in order to avoid breast issues. Fulcrum is posterior to the glenohumeral joint, and stationary arm is aligned lateral to the humerus and pointed to the floor. A mobile arm will be at the midpoint of the humerus. So can you please adopt your arm to the side of the body as high as allowed, with palm facing forward? Okay, now we're going to proceed with shoulder abduction, manual muscle testing. So the position will be arm at 90 degrees, and I'm gonna go ahead and push right here. Can you please hold? Don't let me push it down, okay? Hold. Thank you. So now we're gonna measure shoulder horizontal abduction. The measurement is 0 to 40 degrees. I'm using an 8 inches goniometer this time. The position is sitting on a chair, feet on floor, good posture, arms straight, and palm facing forward. The fulcrum will be on top of the acromion process, and the stationary arm will be on top and line up with the humerus, and the mobile arm will be on top and line up with the humerus as well. So can you please abduct your arm? Now we're gonna do horizontal abduction. So I'm gonna stabilize here, and the patient should have the arm abducted, horizontal abducted, and my instruction to the patient will be don't let me push it to the front, don't let me move you. So now we're gonna proceed doing shoulder horizontal abduction. The range of motion is 0 to 130 degrees. I'm using the 8 inches goniometer. The testing position is sitting on the chair, feet on the floor, good posture, arms straight out to the side, parallel to the body, and palm facing forward. The fulcrum will be on top of the acromion process, and the stationary arm and mobile arm will be on top and lined up with the humerus. Can you please keep your arm straight and abduct your arm toward to your body? Now we are going to proceed doing manual muscle testing for shoulder horizontal abduction. So I'm gonna stabilize the scapula right here, and the patient should have the arm already on abduction, and my instruction will be don't let me move you. We're now gonna do shoulder internal rotation. The degrees are from 0 to 70 degrees. The range of motion, I'm using the 12 inches goniometer. And the testing position will be sitting in a chair, feet on the floor, good posture, humerus parallel to the floor, and the elbow bent at 90 degrees. Fulcrum will be on the olecranon process, and the stationary arm, mobile arm, will be along with the midline of the ulna. So my instruction to the patient will be to please keep your humerus parallel to the floor. So can you please rotate your forearm down to the floor? I'm gonna test manual muscle testing for shoulder internal rotation. So the arm must be in 90 degrees, and I'm gonna ask my patient not to let me extend her arm. Let me move you. Thank you. We're gonna do shoulder external rotation. And for external rotation, the arm must be in this position, 90 degrees. And my instruction to the patient will be, don't let me push it inside. So now we're gonna proceed doing elbow extension to flexion. The range of motion degrees are 0 to 150. I'm using a 12-inch goniometer. The testing position is sitting on the chair, feet on the floor, good posture, arm resting to the side. And the fulcrum will be in the lateral epicondyle of the humerus, and the stationary arm on the center of the humerus, and the mobile arm on the center of the radius. So says for my patient to please bend your arm to forward the most as you can. Okay, for forearm supination, I'm using this goniometer, the 8 inches goniometer. The range of motion is 0 to 80 to 85 degrees. It depends. And the testing position should be the shoulder at 90 degrees. The patient will hold the pencil, and the fulcrum will be placed on the third metacarpal. The stable arm will be parallel to the floor, and the movable arm will follow the pen, in this case, when turning. Can you please supinate your forearm? Thank you. Manual muscle testing for arm supination. I'm gonna ask the patient, please do not let me supinate your arm. For arm pronation, the movable arm will be pointed to the ceiling, the stable arm pointing to the floor, and the axis will be focus on the third place on the third metacarpal, the PIP. And I'm gonna ask my patient to please rotate her arm and then her forearm into pronation. For manual muscle testing pronation, I'm gonna ask my patient, do not let me pronate your arm. Now we're gonna measure the wrist flexion motion. So that we're gonna use the 8 inches goniometer, and this motion can be, the range of motion can be from 0 to 80 to 85 degrees. And I'm gonna, the mobile arm will be along the forearm, and I'm gonna ask my patient to extend her arm, her wrist as much as he can. In this case, I'm gonna ask you not to let me push it up, okay? Manual muscle testing. So the position of the mobile arm will be towards the ulnar midline, and we need to, and for the mobile arm needs to follow the hand of the wrist motion. And my question to the patient will be to please flex her arm as much as she can. And the motion should be from 0 to 70 degrees. We are gonna have the arm in this position, and I'm gonna ask you please not to let me push it down. For wrist ulnar deviation, we're gonna measure the range of motion is from 0 to 30 to 35. The wrist is neutral, fingers in extension, palm flat on surface. The axis is the dorsum of the wrist at the base of third metacarpal. The stationary arm be in the midline between the radius and ulna. And the mobile arm dorsal midline of the third metacarpal. And my instruction for the patient will be to please move your arm into your ulna. For wrist radial deviation, the range of motion is from 0 to 20 degrees. The client is seated, the forearm pronated, wrist in neutral position, fingers in extension, and palm flat on surface. The fulcrum axis is the dorsum of the wrist at the base of the third metacarpal. The stationary arm in the middle of dorsum of wrist. And the mobile arm goes dorsal towards the midline of the third metacarpal. And the instruction I will give my patient is to move the wrist laterally toward the radial deviation direction.